Yasmin Effath, thank you for coming to Ayurvedic Healing and Beyond. Now, I read about you that you do flower consultation and you do lactation consultation and also do craniosacral therapy.
Right.
Now, tell me, where did you start this? What was your story behind this?
Okay. So I have to go close to about 17 years behind
Mhm.
to look at what really pushed me into doing what I'm doing today. I'm very grateful for the experience, but let me take you through the roads of a bit of pain as well, right? I've had a couple of miscarriages
Mhm.
during the early,
What age were you then?
um, maybe about 27,
Mhm.
around 26, 27 years old. And pregnancy wasn't a really easy journey. Even conception wasn't an easy journey. There was no medication. That is not the road I ever wanted to take. I wanted to go natural as much as possible. Um, so these experiences got me to a point where I started to have a lot of self inquiry. So during the time of pregnancy, there were several hospitalizations that happened during that time. And then it was a cesarean section.
Mhm.
And I think just like every woman goes through, there's not much of education that you put yourself through.
Mm.
There is no childbirth education. There is no understanding about what do you need to know, how do you approach this, how can you get your body to be prepared. This is not something that is there in a common understanding of people.
Mm.
And I was just the same. But yet, mm, through that experience of the pregnancy, the miscarriages, and what happened after the birth itself, there was a disconnection that I started to feel between my mind and my body,
Mm.
which I could not understand. So the question started, the inquiry started to feel, why am I feeling this way? Why am I not connected? The feeling of connection with my daughter,
Mm.
my baby, for which I was looking forward for so many years,
Mm.
right? And that was unsettling for me, Dr. Vignesh. So I had to inquire to see what is it that I'm missing in this process. And somehow I was catapulted in the world of birthing, natural birthing, and the people that started to come into my life were completely different from what I was interacting with otherwise,
Mm.
right? And those women brought a different perspective into my life about the connection between how a body can give birth without too much of intervention and what does it mean to experience a natural birth,
Mm.
right? So this perspective started to come much later after my baby was born. So that's one thing. And the second is my feeding journey with my baby, the breastfeeding, the mother feeding, which I call, was extremely challenging, very painful and very challenging.
The breastfeeding one.
Yes, that itself was very painful. So you would think that if it's such a natural act of a mother, nourishing her baby at her breast can be painful. Does it even seem normal?
Mhm.
Can it seem like most mothers can actually go through that? I think those questions are constantly that pushed me towards it. And I consumed a lot of information, knowledge, trying to get behind the scene to find out what exactly is happening because doctors were not able to diagnose why this is happening. You would go to them, they would say everything is fine. Maybe you don't know how to feed. They would put questions on your ability to nourish your baby
As if it's your problem,
as if it's my personal problem
as
that
if you're
I don't
lazy
have the
or.
art
Mm.
or I don't have the understanding, I don't know how to feed my baby, or I don't want to feed my baby. So these were things that started to cloud my mind.
Mhm.
So this can't be the case. There has to be something that gives you the answer for that. And that's how I became a lactation consultant. A
Mm.
sort of very beautiful young German woman who
Mhm.
supported me through the breastfeeding. She was a part of an organization called La Leche League International.
I see.
Now, this organization supports women for feeding.
Mm.
So, if any woman reaches out to them, they would do a phone support, they would do a chat with you, or they will give you books to read, or they will encourage you, they give you some moral support, they give you some tips to say, can you try this, can you try that? So, that became my lifeline of support during that time because I wasn't getting answers. But having said that, the kind of moral support I was receiving kept my journey going But yet the actual issue wasn't getting resolved, which was pain. Right? So I went on with this journey for about 2.5 to 3 years. So that means I continued to feed my baby through the pain. And the pain was almost a toe curling pain, Dr. Vignesh, which means that you're waiting for when the feed is going to get over. And you're dreading when the next feed is going to happen. Imagine having to mother a child in that kind of constant cycle of anxiety. And so answers
Constantly on guilt then.
or constantly on guilt. The guilt was to such an extent I cannot even tell you. I would sometimes beat by myself. Why would this happen to me? Why is it that I am feeling this? Or sometimes I would direct it towards my baby and say, why don't you open your mouth wider? Maybe that will become easier. So it is a constant saga of that pain. And the next minute I would just take her and, hug her into my bosom because she's just a baby. What could she do? Right? She's just an innocent being and I'm putting her through this. So, and yet I don't want to give up. You see that juggle and the chaos that's inside the mind, and the heart wants to keep moving towards the truth. The truth is that I want to nourish my baby. I will do it no matter what. That is the only single thing that takes me through that. I don't have the answers, but I'm willing to live through this if it has to be this. But I will make sure that I'll get the answers. So if there is an opportunity for me to support somebody else, I will do it. But what in the hindsight, if I look back at it, there was not a single day where I had a question, why me? That question never came to me. If this was a part of my life, I would go with it. I never had a question of why should I go through it. Now, which I do see a lot of mothers go through. They will sometimes ask this question, why am I going through it? Why is my baby and me going through this problem? That's a question that has opened many, many pathways in the heart, I think. If I look at it hindsight, I don't know if I had the wisdom at that point or not, but this is something I'm looking forward now after so many years. So that's how I became a lactation consultant. So this specific issue that started to emerge in front of me was, it's called a tongue tie. Now that obviously took me into a different world because it is to do with the entire body. One is that. And let me just explain to you what that tongue tie means actually. So we have connective tissue in our body, right? And this covers every single organ system in the whole body, starting from the brain to the organs, the heart, the lungs, whether it's the kidneys, everything, including every single part of your body from the head to the toe. Now, this responds to outside stimulus, an extremely sensitive response to it, which is what we do in yoga. Yoga responds to the fascia. The fascial system starts to undo and recoil itself into a state of wellness through yoga and meditation. Now, this is directly impacting what I am calling is the fascia. Now, a part of the fascia is tightened through birth itself, like an anomaly, birth anomaly, which is called the tongue tie, which is right underneath your tongue. So, your tongue blade is here, and the connective tissue that anchors the tongue to the floor of the mouth, it's meant to be elastic.
I see.
But when it's not elastic and it's tight, it's called a tongue tie.
I see. So it is tied.
It's tight.
And stuck.
It's sort of holding it down. So when it's holding it down, what's happening is the mobility of the tongue is restricted. And the mobility could be lateral ones or elevation, protrusion, all of that. This can impact how many things? It can impact latching with the mother's breast, sucking, swallowing, digestion, breathing, digestion and elimination process, sensory integration of the body, posture and balance, and so sleep. So
also communication.
Communication, speech. So you can see almost about 10, 11, 12 different functions, primarily to do with the impact that the tongue supports. The tongue as an organ system by itself as a muscle really supports this many functions in the body. And so, if that is impacted, then your feeding cannot happen. So, around 50% of babies cannot feed because who have a tongue tie, they are not able to feed because of this reason. Now, what is the percentage of it? That's a different story altogether. But approximately about 10 to 15% of babies are not able to get to the mother's breast and feed well. They are
Because of
weaned off
this.
very, very early, right? So, my baby had that, which was not diagnosed. And I had to learn through that process and actually understand that, okay, this was the problem and this was the thing that prevented me from that. But I had some answers to it. But I did not have all the answers. I started to see that birth was having such an impact on the feeding, and we did not have a way to resolve that, Dr. Vignesh. And for me, that was a corner point. Like, being a lactation consultant, you can do positioning, you can use different maneuvers to use gravity, to be able to position the baby better, to help the baby kind of bond with the mother. You can do so many things with that skill set. But what you couldn't do is to heal
The pain or
the heal the you know the difficulty in continuing to you know, stay functional. Basically, it's a functional act. Breastfeeding is a functional act. You have to engage with your muscular activity and the craniofacial structures to you know, take the milk out of the mother's mouth. That is not an easy thing for a baby to do, you know. The nervous system is engaged, the muscle system is engaged, and the baby is completely using all of these skill sets to labor at the mother's breast. And it's not just an act of, okay, I'm there and I can feed. No, it's not. Because it's using so many different things. And that I was not able to resolve. So that's when craniosacral practice as a therapy, as a modality came into my life. And this was a game changer. Why? Because it was able to look at the whole body as a single unit, and we were able to do gentle, non-invasive treatment. Which did not involve massage, which did not involve me to maneuver the baby's legs and hands or the head if there is any tightness anywhere. I didn't need to do that. I needed to use touch. So craniosacral practice actually engages with the body, with touch, with very gentle awareness, and allows the inherent treatment plan to start to unfold. What I mean by inherent treatment plan is the body has a default state of wellness and health. Now, if that is moving away from it because of any events that have happened in life, which could be a difficult birth or an intervention during birth, that can alter how those muscles are working or how the nervous system is working. If the nervous system has got shocked during cesarean section, now your body is going to have those imprints in the body. How are you going to resolve that? Baby is
you mean the
constantly
mother or the
crying.
child or
The
both?
baby also, mother also, right? So mother can, you know, use her mental capacity to overcome certain things, but baby cannot. The baby is not able to do that. And there is a disconnection between the mother and baby, right? When that is also happening, how are you going to resolve that? So you got to hold space for them to come together. And that's why craniosacral practice was really a game changer for me, to support the babies. And then I noticed that just with the therapeutic approach and allowing that non-interventive work to happen, that muscle activity in the nervous system starts to reset itself and come back to its default state of wellness, and then things are happening better. The tension patterns in the body is resolving. Better positioning can happen. Muscle activity can become increased. Potential becomes higher for that. So baby is able to suck and swallow and breathe better. So many things are happening additionally. So you can see these pieces came together that allowed me to kind of redefine that the space of working with a mother and baby. And that's why I value all of them so much.
So, in today's practice, Now, to what percentage do you see this lactation problems? Is it like many? I'm sure many mothers, when they are going through, they think something wrong with them, and it goes undiagnosed and unattended.
Most of the time it goes undiagnosed. Now, if you see, there is a universal statistical value of more than 97 to 98% of mothers initiating feeding after birth. That means everybody wants to feed. By the time we reach close to about 3 months to 6 months, you are dropped down to 42%. At least that's an Indian figure. On an average, that's the figure around the world as well.
This
but
is what we know as
we
of
know.
now.
So 42% of the babies are the only ones who are still at the breast at 6 months. Whereas the journey of recommendation of how long a baby should be with the mother and having her mother's milk is close to minimum 2 years. And you can see the gap. Now the gap, why is the gap? Is it because mothers are not motivated? Is it because we don't value mother's milk? I think that was the case for a certain period and certain population, but I don't think that's the real truth. The real truth is we are not able to really see the gaps that are the factors that actually prevent such a huge number of babies to not wean away, which could be social issues, right? Do we really trust the breastfeeding? Do we trust the bond that is actually required? Do we trust the ability of the mother's milk to be the life force of the baby? That I think we don't really value as much. We don't have a very trusting society. The whole world I'm talking about generally. We believe that what is being formulated in the market is a better food to have. And this you will see in other things as well, not just with mother's milk, but general food also is
Even bottled
considered.
water, for example.
Bottled water, for example. Bottled water or foods that are in packaged food. All of these are processed. So we believe that processed food is much better and has a lot more nutritious value than
Mother's
natural.
milk.
Natural. And that gap of education is what is causing this to occur as well. And then you're introducing the understanding that the mother has to go back to work. The mother needs to be in the workforce. So you are not valued if you're not in workforce. Do you see how many values come around that? So many issues. So if you're not in the workforce and you're not climbing the ladder of the corporate world or the workforce role, then you're not valued. You don't bring in money home, you're not valued. So therefore, mothers feel the value of being outside much better than having to take care of a baby. So they will have to wean the baby by 3 months. Because most governments don't allow babies and mothers to be there together for exclusive breastfeeding for more than 3 months. Even in fact, in the US, it's less than about a month. They get a maternity leave only for 1 month. But in Tamil Nadu, for example, they give close to about 9 months to about 12 months now. Most other places about 6 months, 3 months. 3 months is average, right? So after that, what happens? So that's another issue with it. But there are, like I mentioned to you, so there is market forces of the food industry. Then there is issues with having to go back to work, and you don't trust the nurturing quality of a woman, what she offers to her child to be valuable to the society. That's another thing that you're seeing. So all of this together, there are multiple factors that we are not able to kind of support the mothers.
So, how do we help them, and what could be the cause for this? And once we know this is the cause, what will be the next steps that they should take?
I think which also I think Ayurveda really believes in, is awareness and consciousness. I think we have to fall back on that. If you don't see the value of us as a soul and a spirit in this world, which is meaningful, and what we offer to the world in our own capacities, in our own roles as personalities, as gender, whatever we have been given. If I'm a woman, then I have a natural ability to nurture. Now, I cannot give that up. Now, I must value that. So, if I start to value who I am authentically, then I think we will move away from the clutches of what the societal structures will make us think in certain ways. I think that's a very crucial point. We tend to become enslaved with various forces outside of us, which could be power, money, um, abuse, and incorrect social justice or injustice. Let's put it that way. Injustice to the social world, and we feel like we become slaves to that, and we start to worship it. Now, that's where we need to understand the importance of one of the beautiful verses in the Bhagavad Gita where Krishna says that as long as you will serve the demigods and the world of demigods, you will continue to be in that world and not come out. And the day you understand me to be the only truth, that day is your moksha. See, that's the importance of understanding how can we break these cycles of enslavement is to move away from these attachments that we have of importance of all incorrect connections that we have in the world. If we move away from that and become conscious of why am I here and what's my purpose, whether it's a man, woman, does not matter.
I think
that
Yasmin ji, this can be applied to all the most of the lifestyle
everything in the
problems
world,
that we see, and also so many things.
everything.
And coming to a
And as a
mother's-
woman,
yes,
right?
I can-
As a woman, imagine she has been given the empowerment to have the womb, which is a privilege
which man doesn't have.
which a man doesn't have, right? So if I have that privilege to have the womb, that means I am the one who's going to have to, bring the change and be the change. That's why most mothers will, no matter how far they go away, they want to make sure that they give natural food for the children. Whether they give it for 6 months or 1 year, doesn't matter, but they give it. Where others are not thinking about it, but she wants to. That's why the struggle, Dr. Vignesh. So if I'm going to a doctor says, if your baby is not able to feed, let's give formula to the baby. But the mother says, no, I don't want it. I want to give my milk to the baby.
Correct me. That's what the mother is
Yes,
saying.
correct me. Correct the problem that is happening. I don't want to give something else. So nobody understands that. Nobody understands the anguish the woman is going through. And why is she going through that? Because by nature, the default is always that you will come back to the root, to the nature. So if you're connected deep-rootedly, whether we understand it or not, you're primed to do that. You're programmed internally to get back to where you are. You can't move too far away. You cannot actually. And women understand that. You have that intuitive sense, right? That intuition is something that we really need to harness, listen to, and deeply be connected to.
So Yasmin ji, this is I'm sure this most of the women and humanity have to listen to this wisdom that you mentioned. At the same time, let's also understand what are the practical tips. Sometimes I've seen some patients, the mother comes and tells, I sometimes feel guilty that I was not able to breastfeed my child. And at that time, when you go in deeper, I was going through a divorce soon after the birth. And because of the litigation, all the stress and the financial stress and all the things that she was going through, she felt she was not able to breastfeed.
Yes.
But if you go a little more backwards, she said her mother-in-law was very upset that she was not able to breastfeed, and that perpetuated and made it worse.
Right.
So, I mean, this is just one example.
One example. I'm sure there is a whole...
There are many other examples. Sometimes, as you said, the mother has to get back to work.
Yes.
Or sometimes the father has to... I've known cases where the mother earns more than the father.
Yes.
So, the father will babysit while the mother goes and works.
Yes.
And you could definitely see its own problems because of that.
Absolutely.
You can... Father, of course, father is important, but father can never replace the biological mother's love and affection and the breastfeeding that the mother can provide.
That's true.
So what is the next step once they know that they're struggling to breastfeed?
Right.
Or the milk is not coming, or they are struggling, or something is not going
so
right.
these are common situations.
What will be the first step that you would recommend?
Yes. So I think the first fundamental thing that we need to remember is first is to make sure that we support natural birth. The most gentle approach and gentleness that we can provide during birth can prevent majority of the issues that are not social, the ones that you mentioned, where somebody is going through a divorce. But I'm talking about milk supply issues, issues where the baby is not able to, latch at the breast and feed. So these things, majority of them can be settled if we have a very gentle approach towards birth. If you medicalize birth, then you're going to have some issues or the other that's coming up, which could be either using a forceps, vacuum, cesarean sections, and the numbers are rising. Like if you see most of the cities, 60 to 70%, some of the private organizations, hospitals, I'm talking maternity hospitals, they have cesarean rates, 70% cesarean rates.
No, there are multiple studies which
Multiple
talks.
studies that will show you that. Now, that's a whole battle by itself, right?
Mhm.
So, either in India, if you see, you have either too little help during pregnancy and birth, or you have too much help. So
Both
neither of it is,
extremes,
both
yes.
extremes, and it's never going to really support what we require. So the first I would say is fundamentally make sure that we have all support from all stakeholders, not just the mother and family, but maternity support that is provided by the hospitals or the nurses who are there, or the midwife or the doula who is there, or all the family as well. So every person in the society needs to be educated enough to support a mother through natural birth.
Hmm. So
And
that's
then
the first.
that's the first step.
Hmm.
That really resolves majority of the issues that you will
And
have.
do we have a real study or any correlative data that when the mother is having a non-natural birth,
Yes.
that it leads to.
Yes, the first thing that happens after that is separation
Hmm.
between mother and baby, and that puts the baby in a very vulnerable spot of going through a lot of anxiety and distress,
Hmm.
biological distress of being away from the caregiver, and that can trigger off cortisol in the body, and the baby is constantly in that hyper alert state in the nervous system that becomes a sympathetic response in the body.
Hmm.
So it's not able to reset. So you have that distress going on. So the limbic system in the brain, the limbic brain, starts to be altered. Basically, that's what's happening right from the beginning. Imagine now how you're going to respond to the stress in life if you're already primed for so much distress at birth.
Hmm.
If your birth itself is coming in with so many fight or flight kind of a situation all the time, or freeze. In what my understanding with being a craniosacral practitioner is, during birth you cannot run away from the situation or fight the situation. You can only do the third response in the nervous system, which is freeze.
Hmm.
So I'm frozen in my system. Now I don't know how to. So frozen means you get dissociated. And as a practitioner, that dissociation is one of the worst situations. It's almost like you have a file sitting inside the computer and you don't know the name of the file.
Hmm.
It's lost. Like you can't process the experience at all. And so you cannot have that understanding of what happened during the birth process.
Hmm.
How do I process this and how do I understand? So everything in my life will look like stress. Even what you were talking yesterday beautifully, perceived threat,
Mhm.
you said. Everything becomes a perceived threat.
And that perceived
Bec-
threat feels like real threats.
Real threat. Why? Because I don't know what is normal.
Mhm.
Because I was born in an unnatural setup.
Hmm.
So it plays throughout life, Dr. Vignesh. So that's the first thing. Second thing is to give the support for the mothers to make sure, even if there has been an intervention and a separation, let's gap that and bring the baby back immediately to the mother's breast.
Hmm.
Leave them alone for significant amount of time so that they are able to find those biological markers that bring them together. So you have these primitive reflexes in the baby. The reflex of stepping reflex, where the baby's legs actually move, and then you have a crawling reflex during that time, and you have the sucking reflex, you move towards the breast. So all of this, if you are able to elicit at that point, things can become a lot more normal so most babies can be supported with that. But if you are going through a social issue, or issue that is going on at a mental level, where there is stress, where the relationship issues are going on, or divorce is going on, or you need to go back to a work, or you're dealing with your in-laws comments, right, which can be such a big thing for them. So what we need to understand as women is that what is primary priority in my life.
Hmm.
The truth is that I have to take care of this baby, and this baby is exclusively dependent on my body. A bigger truth of that cannot be.
Yes.
Imagine a mother
Completely at the mercy of the
at
mother.
the mercy of the mother and her body. So imagine if I can reprioritize my life to recognize this is the most important thing that I need to do at this point. I think I think that's a practical tip to understand. Mentally, you can push away the things that are really bogging you at that time. But if you need therapeutic support, flower remedies can be significant support for your mental challenges that you're facing. For example, I'm going through anger, I'm going through sadness, I am grieved by loss of a dear parent. It has happened so many times when mothers have become pregnant and they are giving birth, they would have suddenly lost their mother. They would have suddenly lost their in-laws or somebody who's loved one in the house. So you can go through plunged into a shock and trauma and going through difficult time of grief. So what are you going to support with that? Flower remedies can really come in rescue, where each flower has a beautiful way to bring you back to the state of wellness in the mind, to be able to understand the situation in the way it should be understood. That yes, there is a loss, but I am okay. That I can prioritize what I need to do at this point and carry on with life. Because otherwise, we are choked with emotions. And the emotions, like you mentioned yesterday, that can flood different messages through the body and it can impact the entire body. So it can impact the flow of the mother's milk as well. Absolutely, it can. Yet at the same time, we have the power to bring back the mental support into its state of balance naturally through flowers. We can do that. Or second, you can do counseling.
Okay.
Counseling can also help a lot. Yeah.
So what you're saying is, if the mother is going through some emotional stress, this can definitely impact the milk production.
Absolutely, it can.
Any other causes or physiological or pathological causes?
Yes, there are pathological causes as well. Like you, again, what you were constantly, bringing the focus of the entire group yesterday was about hormones, right? So you have a very intricate, very delicate and fragile interactions and interplay of hormones.
Yes.
During birth and breastfeeding. Right? So those hormones, we think of it like, oh, the oxytocin, we need the oxytocin, we need the prolactin for production of milk. We think of it as just one or two of them, but that's not the truth. The truth is there is a amalgamation and interplay of many different hormones to make that work as a system. Right?
It's like an orchestra.
It's an orchestra. It's a beautiful orchestra. So if any mother is having a thyroid issue, for example, she can have an impact on mother's milk supply. It can be there. If your cortisol is too high, it can have an impact on it. And if your oxytocin is not getting released, immediately it's going to have an impact on the letdown of you. So all of these things can play a role. Now, if I can give a safe environment to the mother, either by others or the mother is educated enough to create a safe environment for herself in her mind, because we live in our mind more than we live outside.
Definitely,
We know
yes.
that, right? So if we can get a grip of our mind and be able to live, create an environment of safety inside the mind, then I think majority of these hormones will not get up and down and dance around for it to kind of cause such a big turmoil that can happen, which can
So
have an
if the
impact on
mother
that.
is having thyroid issues prior to
Yes,
birth,
prior to birth.
or any other particular issues that or high cortisol problems?
Yes, you can have that, or you can have issues where you have PCOS, for
PCOS,
example.
okay.
That can also play a big role in that.
And even gestational diabetes.
Gestation diabetes is there, and hypertension, which is called pregnancy-induced hypertension, or gestation also is related with only with pregnancy, for example, GERD, which you call it, right? So all of these conditions are somehow seen to be very connected with during the pregnancy alone. But it's actually not true that it's only pregnancy related. You already have markers before that. In pregnancy, you're going to see it as a clinical issue because it's only showing up its head. Because during that time, your body is going through so many enormous changes and it's a transition period. So anything that is already going in a wrong direction is going to show up its head during pregnancy. And during pregnancy, they will identify it as gestation diabetes or pregnancy-induced hypertension, or you have preconditions such as thyroid issues. Or I'm telling you, 23-year-olds and 24-year-old women today during pregnancy, they are already on thyroid medications 5 years before or 7 years before that. So which means people are starting to have medications right within the first few years of your puberty. And the alteration it's doing in your body is big. And then you're going to see its repercussion that's going to come out during the feeding time. Absolutely, it's going to do. So you really need to get a grip of understanding how the body works and how can we prepare the body ahead of time and make sure that you're not on medications, and how can he can heal the body so that you are going into the state of pregnancy and birthing and breastfeeding in the more state of wellness.
So once we know these are the okay, for you mentioned when mother is going through enormous emotional stress,
Hmm.
counseling is
Yes.
one of the methods.
Yeah.
So what would be the nature of this counseling?
Nature of the counseling.
Like, let's say the mother is saying, I'm feeling helpless, or I
Hmm.
feel I'm not able to support the child. I
Hmm.
think every mother goes through this thought once
Oh,
or the otherwise.
yes,
I feel I'm not a
absolutely.
good mother. I
Yes,
didn't do justice to my child. This
yes,
is one of the
yes.
talks I constantly hear
Constantly here.
from my
Yes,
patients. I'm hearing.
yes,
I've not been a
absolutely.
mother, but I hear it
Right.
through my patients. That's how I'm able to
Yes,
say that.
yes. So I think the foundation of counseling is acknowledgement.
Hmm.
And if you ask me, there is no bigger power of healing than acknowledgement.
Hmm.
And acknowledgement can be done with words during counseling, it can be done with touch, it can be done with that engagement that we have with the person in our physical physical arena,
Hmm.
basically. So acknowledgement is giving a sense of safety to the other person that
Hmm.
you are okay, we can journey through this, we will manage this, we should be able to do this. So that hope that we are kind of infusing into that relationship is what comes through counseling. And the number one and the most important is the art of acknowledgement.
I think when we don't get the acknowledgement at
No,
home.
no, no. You cannot get past it
Hmm.
because, um, every human being has the more fundamental need to be heard and to be seen.
Hmm.
Now, if I don't see that person and can't see your pain, then there is a big block that comes in front,
Hmm.
that my mind cannot get engaged at all. Until my heart is feeling safe, my mind cannot kickstart its process of engagement with life,
Hmm.
which is making decisions, for example, or looking at what I must do in this particular situation. I cannot do any of it because my heart is feeling unsafe. And the heart is the house of all the emotions.
It's one of the first organs that are.
Yes. And if you ask me, all diseases in the human body are the diseases of the heart.
Hmm.
And if we can heal the heart, everything else is healed.
I mean, blood is pumped there.
Everything. But that's the seat of truth, and it's also the seat of all the emotions that we have. And those emotions, like you, again, which we all understand together, is the seat of all the issues that happen in the physical body, changes in the hormones, changes in the physiology, changes in the fascial system of the body, and the sense of freeze that we have inside the body, and the response of fight, flight, freeze responses that we have. All of that is coming in the physiology because of emotions, right? So, the emotions, if we can regulate the emotions, then you have a grip of many things that you have in the whole
So I think
body.
it starts with acknowledgement, and I think once we get the acknowledgement, we feel heard, and when we feel heard, I think what happens is we feel safe.
Yes, the minute you feel safe, then the body functions automatically because it already knows the answer. It knows how to function. It starts to think, it has ideas, brings a curiosity. Everything is there. The mind is meant to be that way. But when the heart is not feeling safe, then everything is blocked. And so, acknowledgement is the only way to open the heart. You know, and one other thing that I wanted to mention is when I was doing my study for craniosacral practice, we had an in-depth understanding of embryology. In one of those lectures, it was very intriguing to see the stages of how the heart develops, right, from the embryo. It is a long tube. The heart is a long tube, and at some point, it actually recoils itself and locks. It's absolutely beautiful physiology that you see, and how anatomically it is designed, and the form, and how it functions. So the heart is like a long tube. It coils itself and it locks, almost like a bow. You put a bow, it's almost like that. And I always wondered, like, why does it lock itself? Why couldn't it have been a long organ, for example? And the answer to me that comes to my own consciousness is the heart is the seat of truth. So it knows the truth. So it does not require an answer from outside. So everything is locked internally. So all the wisdom is inside the heart, right? What it needs from outside is an acknowledgement that I can feel your pain and I can see your pain. And through that acknowledgement allows me to remember the wisdom that's already inside me. Right? That's all it is about. And that heart actually shows you, that form also shows you that beautiful, connection between the heart and the mind. And that I think is
That's
very
quite
important.
profound, how
Yeah.
important our emotions are and emotional
Yeah.
regulation is.
Yes, emotional regulation is.
Anything other than counseling that a woman, a mother who's struggling with breastfeeding need to know?
I think it's important to know that there is support outside, clinical support, which I mean. Societal support, of course, it's there. There are different groups, breastfeeding groups that are out there. There are mothers, there is mother to mother support groups like Lalache League is there, BSIM is there, which is breastfeeding support for Indian mothers, if you're looking for India. So these are all large groups where you get lots of mothers who are socially supporting you, available to you, available to listen to what you have to go, what you're going through, and give you tips on it, and or give you moral supports. Hang on there, everything is okay. We can get through it. Baby's feeding very often. Baby's crying sometimes. Baby's having cluster feedings in the evening, like for 3 hours, 4 hours. How do I sit through this? It can be really a lot for me. So they give you perspective, they give you an understanding. This is a growth spurt of a baby. Hang on there, don't leave it. Baby's just growing. Baby needs a lot more stimulation. Baby needs a lot more milk. So that's the balance that we create. So this is one support, social support you can provide. Second is there is clinical support. So you have lactation counselors, you have peer support, which are different grades of certification. And you also have an international board certified lactation consultant,
I see.
which is called IBCLC. Now, this is a minimum standard that is provided by the international organization to be able to give standard care support for a mother who understands technical issues that are coming in. It's not just about motivation. It's about positioning. What is the tightness? Where is there tension pattern there? Is the baby not able to suck? Is there sucking reflex a problem? How can I facilitate that? So like a doctor does, an IBCLC can support a baby.
Okay.
So that's one thing that mothers should know, because that's a new profession. It's not something that's been there for a long time. So we have close to about 35,000 IBCLCs in the world today.
I see.
It's a smaller number compared to the mothers that we have, but yet a very promising support that can be give a great hope to both in the hospital setup as well as home setup. Yeah.
I want to go back to one thing. You mentioned if the birth is not natural,
Yes.
the tendencies of these problems with breastfeeding can-
Exacerbated. Yes.
But I've seen certain children. I mean, when I take the history, did you give birth the natural way or cesarean? They say it was cesarean, things were normal. Is it like for every cesarean case it is like this, or
No,
the
I
chances
think
are
the
high?
chances are very, very high. The
But
chances
not that
are
it is for everybody.
not true for everybody. So everybody is not going to go through the same problems, but it is not a natural process.
Okay.
Right? A baby has to go through the contraction, the experience of contraction of the mother's labor, and approximately most births would be somewhere around 6-7 hours, 8 hours, 10 hours, sometimes runs into 72 hours. Right? That's the process of the birth. And that resistance and allowance process of the birth really prepares you for life. And those of us who have missed the opportunity to have that experience, which is a somatic experience, bodily experience of birth, they tend to not know how to take the stresses of life later on in life. Right? Everything becomes a perceived threat for us. So, yes, it does play a role. Now, when people say, where is the impact? It's not so much of an impact. We will have to redefine and ask, what do you see as an issue, first of all?
Understood.
isn't it? Like, we don't even see what is the issue that we need to recognize and be acknowledging of. I think that's a big gap. Like, when, for example, when I was talking about tongue ties to you, we know the impacts that are there. So people say, oh, but many people in our families had tongue ties, we never really knew what the issue was. Now they don't know the issues that they have faced are related with that. So it could be diagnosed as some other problem, but not necessary that you know that, oh, this is the cause of it, right? Sometimes we don't recognize the trail of the events of it, but any alteration. So one of the other things that I wanted to mention here was trauma is not in the event itself.
It's how you perceive it.
It's how we perceive it, right? So if there is anything that happens too fast and too much or too little, then you're going to respond differently to it. So if you are already prepared, that's why you can ease the process. So even if you're doing a cesarean, there is a need for cesarean, because cesarean is a life-saving surgery. For some babies and mothers, you absolutely need it. And you have to honor the place of the intervention.
Yeah, I can imagine so many deaths have been prevented
Because of
cesarean,
it. So yes, it is important.
But now
But
it's
when you start to overuse it, is a problem, right?
And also for monetary benefits.
Monetary benefits, correct. So if we are having to go through a cesarean and that's something that you cannot avoid, then how do you prepare the mother? How do you prepare her mind and body to know that she is going through something and she's been supported through that? That makes the difference. There is no trauma related with that.
But even if the child is born through cesarean, it can be reversed.
So craniosacral therapy can really play a big role in that.
Okay.
Yeah.
Now, can you talk about craniosacral?
Craniosacral. Yeah, it's a new modality. So I think a lot of people don't understand that. So I'm just going to start with the precinct of what is the fundamental understanding of craniosacral, right?
But what I understand from the word is it has a lot to do with the spine.
Lots to do with the spine, lots to do with cranial system. That's what we think of it. But if I have to define that for you, the human body has 80 to 90% fluids, right? The rest of it is structural, more structure, bone, muscle, and other things, tissues. And the bigger medium in the body is fluid, right? So if I want to make the biggest change in the quickest manner, which medium should I take? The physical or the fluidic one?
Definitely the fluid.
It feels like the fluid could be the fastest one. And because of its mobility, the fluid has a tendency to receive the information and spread the information through its medium. Right? If you put a drop of color in water, it will spread. All the molecules will receive that information, right? So similarly, if you can engage with the fluid systems in the body and with its consciousness, then you have the biggest change that can occur in the entire body. And that's the fundamental from where craniosacral actually comes from.
I see.
Right? Now, if you see that, that's the understanding that I wanted to give you, because you understand what the body is. But if most people want to understand, I would say, okay, the nervous system has sympathetic nervous system and you have parasympathetic nervous system. The parasympathetic nervous system is the only repair system you have in the body. Every modality has to engage with that. No matter what you do, whether you give medication, whether you do massage, whether you give oil, essential oils, whatever you want to do, you will have to engage with the parasympathetic system, saying, hello, can you hear me? Can you do the work? So then the parasympathetic nervous system is the only one that repairs in the body. So in this also, what we are doing is, where the parasympathetic nervous system is not working and not functioning very well, we are engaging with the nervous system, by gentle touch of the cranial part of the body and the sacrum, which is the end part of your entire nervous system. You are bringing it into balance. Then the parasympathetic nervous system gets elicited and then it does the repair. That's what it does. So if you understand from different perspectives, this is how to understand. But during my study, I think what intrigued me into this subject is more about the fluids and its consciousness. So Dr. Emoto Masaru he's a Japanese doctor, and he studied water as a molecule.
I think the diamond formation,
That formations, that
Fujiwara dam.
crystal formations that it
It was
forms,
on
right?
some Fujiwara dam or
Yes,
some.
Fujiwara Dam.
Yeah, yeah.
So he took different samples of water from different parts of the world, and then he crystallized them and freeze them basically. And then he noticed that they formed certain different shapes, crystal shapes, and he took photographs of it, right? So what he said was that different samples have different shapes. So what does it mean? It means that it's receiving information from its environment and it's registering that information in the fluids, which means water has memory.
Hmm.
So the water has memory, which means it can receive the information and store it,
Mhm.
right? So whatever the environment is giving information, it is going to be seen in water. And that's where his book was come, Messages from Water. It's a
Hmm.
beautiful book. I don't know if you've
No,
read
I
it,
have not yet
but you
read it.
should read it.
Yes.
It's a beautiful book, and he's no more now. He's passed away. But this is where he came from. But what I also then started to look for is your body has water, fluids, 90%, right? So that means the information you're going to give to this fluid system, it's going to change the entire environment because it has memory,
Mhm.
right? And then what makes sense to me is that whichever environment you are in, like for example, you put yourself in a temple or the holy water which you take, that water is going to change the water inside you. And because of the energy that's around you, that is more of towards consciousness, more of surrender, prayer, then everything changes. So if you expose the water to prayer, it changes its structure.
Mhm.
And there are 4 phases of water, which
Mhm.
I can actually go much deeper into it.
We are
But
happy to have that,
it's be
please.
beautiful thing. So Gerald Pollack, there's another scientist who's still there, who's doing a lot of work in molecules of water.
Mhm.
He says there are 4 phases of water. One, we know it is a gaseous form, liquid form, and solid form, right? But the fourth one, he says, is the state which is a gel form. Okay. And then he says that our body actually can be brought to that level with the ions, basically, the negative ions. So if our body can have the charge of negative ion, then it has a tendency to separate and become much more in a healthy state,
Mhm.
which is what ghee does to our body,
Mhm.
you know. And so he's done a study on ghee as well. I wrote to him recently. He gave back the paper to me. In fact, I will forward it to you
Sure,
in the
sure.
email. It's a beautiful paper. And he says, you people have this ghee which you use so much in your foods, and this is what it miraculously does inside your body. So it increases the negative ion charges in the body, in the fluid system,
Mhm.
and that changes the entire biochemistry of the body and becomes more healthier. Basically, that's what it does. So if you take the fluid system from your body and crystallize that, like Dr. Emoto Masaru did, which he didn't do, but I'm telling you, if you marry this thought off, then you're going to see the crystal formation that will be absolutely incredibly beautiful.
Mhm.
And he says any water molecule that is exposed to gratitude, it has the most perfect crystal formation,
Understood.
right? So
Mhm.
it's talking about how your mind can find safety.
And your emotions are impacting your fluids in the
See, you
body.
can see from different sets how people are able to study different things, but we are all coming to the same truth,
Mhm.
that this is what it can do, right? So, in craniosacral practice, what are we doing is we are allowing our neutrality inside of us, which means that if I can settle my emotions, I become the vessel for you to process what is happening inside your body. So, let me give this with example. People understand computers very well.
Mhm.
It's a new age thing, everybody understands, right? Inside a computer, you have a hard drive, you have a RAM, random access memory. In random access memory, you take out all the working files, you open them up, and you work. And then you close them and send them back into the hard drive. That is what it does. Okay? Now, the way to think about what the body does is exactly the same way.
Mhm.
Now, if it does not know how, it does not have enough place to process what you're opening as processes, which is different emotions, choked emotions, then it does not know how to integrate it at all.
Mm.
That is what it does actually inside the body. So it's stored away in different parts of the body and it doesn't know how to process it. And that's what the whole body is doing basically, through the fascial systems, through the connective tissue. So that if you get into the structure, that's what it does. But essentially, what I'm trying to say is that if you allow the processes to close down, then you have more access to integrated understanding about life and not be stuck with one particular thing. Oh, this happened in my life and I'm stuck with it. I lost a job and I'm stuck with it. Or a mother who's feeling that, I don't have milk and I'm done. Like I'm a useless mother. So it can be at different people telling different things, right? So as a practitioner, if I can allow my emotions and my process to settle down, then I can allow a bigger random access memory for a person who is a patient who doesn't have that much capacity to use my random access memory to process it, which
And
is called the co-regulation.
I see. So, madam, so when you say craniosacral,
Hmm.
so how do you incorporate this
How do you
this
incorporate
this
this?
wisdom that
This
yeah.
wisdom, like how do you do that? So let's say you are coming for therapy, and I might take a bit of history for you,
Mm-hmm.
saying what's going on, what is happening. You might say that I'm having migraine headaches, or you might say that I'm probably not able to sleep. I have insomnia issues. You might say. So how do I engage with the physical body then? I probably will prepare you to rest on a
Mm-hmm.
table, on a
Mm-hmm.
therapy table, and possibly have a global touch contact,
Mm-hmm.
which is very gentle touch on your physical body. And I settle down.
Mm.
So for 45 minutes, we are doing nothing.
Mm.
Physically, you're not seeing anything happening, right? But you're engaging with the physical body and the information that it's going to give me through my hands. So it's called afferent information. So when you settle down, you receive the information that's coming in just by staying, becoming the witness of the process. Remember, I told you about
Mm-hmm.
acknowledgement?
Mm-hmm.
So you're acknowledging the physical body in this case. Because you understand the physical body so well, which is anatomy, physiology, you understand the crevices inside your body, you know how the body is structured, how the fluids are flowing inside the body, and you can feel it. Then what happens is you're engaging with the acknowledgement rather than words, you're doing it with touch.
I see.
So when you do it with touch, the body tells you the story. It's like an ocean inside.
Mm.
That's why I talked about the water. So the whole body is like a single bag of water, fluids,
Filled with that emotional.
filled with that processes that's happening. That could look like a swirling water there, and there's a storm coming up in some other place, and the whole body's the structure of the body dissolves. I can only feel a whole big bag of water, and it's not settled in yet. So you stay, and slowly the body starts to settle down. So these processes that are happening internally, like a swirling and storm and everything settles down because it's mirroring what is happening inside of what is happening in me. Because I'm settled, you're going to settle. You see? So when it settles down, it's then the sympathetic parasympathetic nervous system kick starts itself and starts to undo the processes in the body, which could be the hormonal imbalance that's in the body. It redoes that whole thing. If the melatonin levels are lower, it brings it back to balance. Sleep becomes so beautifully arranged within, say, about 5 to 6 sessions.
Mm.
First thing you restore in the body is sleep, because sleep can do many other things, right? So automatically sleep becomes a
I
very,
mean, this is one thing I've observed. Whenever there is an emotional issue,
yeah,
the first thing to impact is sleep.
is a sleep. Yes. And for women, it's their periods,
Mm.
the cycle,
Another, yes, it
menstrual
could be
cycle.
delayed or
So
can be.
sensitive. It's a sensitive marker of what's happening in the body, biomarker. You see? So immediately it's going to show you. And majority of young girls and women today do have this issue, where it's either endometriosis, which is quite a severe situation where there's constant bleeding, or you have fibroids, you have cysts, or you have altered menstrual cycles. And that can impact many other things in their body. Of course, mind and body. Mood swings, crazy mood swings they can go through. So all of that goes for a toss, basically. So what I'm trying to say is that the first thing that the craniosacral therapy can engage with is the nervous system, and it resets it to allow the sleep to become the priority. The minute sleep becomes a priority in the body, most of the other things will start to be taken care of through that process itself. Right? You can feel the fascial system in the body. The whole fascial system is coiled up, tightened, tension patterns, what would I say, torsion patterns in the body, and they start to uncoil and settle down. Just like you will experience it during yoga, for example, right? Similar to that, you can experience in craniosacral heat release for the heat in the body, trapped energy inside in different places in the body, and your neck is tight, or your whole spine feels extremely tight and you have pain, or you can have pain in the head, migraines, for example. So, what are they experiencing? All the fascial systems in the body are having torsions, tightness everywhere. So, once that releases, that pattern releases, then you find relief and circulation is better. What the aim is to get better circulation of lymphatic system, of the venous system, circulatory system, or cerebrospinal system. And cerebrospinal system is not something that most of the other modalities engage with. They feel like, okay, it's there, that's it. Like, what do you do with it? But in craniosacral therapy, the first understanding is the cerebrospinal fluid is your pharmacy. It has every mineral that you require, every vitamin that you require. It has the forces of life that can spread through your body. It has those photons in it, neurophotons, which we call. When exposed to sun, the nervous system receives that information of the sunlight, and it actually spreads it through the body, and it happens through the cerebrospinal fluid. And the production inside the body is approximately about 500 ml. Every day the production is happening internally in the brain, and it's colorless. It doesn't look like blood, it's like water, and that spreads through the cranial system, and there's a circulation that's happening. It has a certain rhythm to it, which we call the primary respiration. The heart and the lung, which we call, is a secondary breathing system. The primary is the life force itself, which you in Ayurveda, I think we can call it as prana, right? And you feel the prana inside. And the rhythm of the prana can be felt in the craniosacral therapy. Very beautifully, you can feel it. Yeah, you can actually feel that breath, the breath of life itself, you can feel. It's a very subtle breath. It's like goes on the breathing of the heart. If you see, of the lung, 12 to 14 breaths you can feel. But when you see the heartbeat, it's 72 for an adult. But when you see the prana breath, the out breath and the in breath itself is 1.5 minutes. It's really that slow. That's slow. Really, really slow. But you can feel it. You can feel the breath. And with gentle hands and quietness, you can feel it. If there's alterations to that, then you know that there's something that's not okay. That's the diagnosis that we do. So you're going at a very subtle part. Very subtle rhythms of the body. Like the story, the wings of butterflies in Africa create tornadoes in America. Like that, yes. It's that like kind of a change that is happening. Yes, and the butterfly effect is really there, definitely there. So you feel the rhythms are very, very gentle rhythms in the body, and you appreciate that, and you recognize it, and you study it. And the more you understand it, the more you get engaged with awareness. So the more the awareness, the more it's going to respond to the system. So
how do you study this? How do you become a craniosacral therapist?
Craniosacral. So there are
If there are
different
people who wants to learn
institutes.
that.
Yeah, there are different institutes that are, able to kind of give the certification process. The certification process is quite rigorous.
Mhm.
It lasts for about 2 to 3 years. So approximately 700 hours of teaching
Do you
has
have
to
to
be
be
done.
present in a school, or
Yeah,
is it
yeah,
like a
you
long
have to be
distance, or
present.
you
No, there is no long distance. You have to learn
go and
it. It
study
is
that?
physical only, but it is something that you can combine with other things. So, it's like adult education. So, it's not necessary that you need to be in college to do that. So, there are different institutes, but we also need to be a bit cognitive about it because it is not a mainstream study yet.
And it's not for everyone, for
It's
sure.
yeah. So, what happens is that every institute will not give you the same depth of understanding.
Mhm. I understand.
So we really need to choose our teachers in this work, especially because it's not a standardized process. So learning from a legacy
Makes a big
makes
difference.
a big difference.
Now, can we just briefly go through the tongue tie, and then
Yes, the
we'll
tongue
go to the
tie.
next episode?
Yeah, it's quite fascinating for me. While it's to do, the focus was more on looking at can the tongue. Can the tongue's lack of mobility, prevent the baby from feeding? The world itself opened in a different way.
Mhm.
The tongue has the first impact on breathing.
Who was the first patient with tongue tie?
In the lactation you're talking
You
about?
know,
Generally?
generally.
No, I wouldn't know that.
Okay.
But I think it's not that it was never addressed. It
Okay.
used to be addressed even before. In Now we resurgence is happening because most mothers are motivated to feed now.
Now, the reason why I'm asking,
Hmm.
you mentioned you had trouble with your lactation.
Yes.
So, like that,
Like that,
not that I
yes.
want to know who the person
Yeah,
is.
yeah, sure, correct. Yes, absolutely, absolutely. So it was very interesting when I got to know about this, and the fact that it has such a huge impact on the breathing plays the biggest role
Hmm.
in your. So for me, the motivation was less about trying to get baby to have mother's milk, but more to restore the baby's ability to breathe
Hmm.
and breathe well through
And
life.
tongue tie and
And the
this
tongue tie prevents it because the movement is restricted.
restricted.
The tongue has a natural tendency and a natural resting position behind your front teeth
Hmm.
on the palate. It has to be lifted up and it's on the palate.
Hmm.
Now, that's not happening in the case of a tongue tie.
Okay.
So, which means it alters the oral cavity. It alters how the palatal shelf is on the top, and then alters how your nasal passages are because it becomes narrow and high. So the tongue actually massages the palate and broadens it and lowers it,
Hmm.
making the nasal passages broad. But when you don't have this contact happening, then what happens is this gets pushed up and the nasal passages become narrow.
Hmm.
So therefore, you're not having the breathing capacity as much. So you can get congested very easily. You can have colds and cough very often. So doctors would look at it as, oh, okay, there's an immune problem. They're getting viral infections. Give them antibiotics. They're not looking at the structure of the body, basically. And what the mother's breast can do is to broaden the palate.
Hmm.
And she's reshaping the entire cranial structure of the baby and shaping it to form the way it is meant to be. And that biomechanics is not very often understood by most women and doctors as well.
Hmm.
And if we understand that link, then we will have more motivation to restore breastfeeding. And so that's how a tongue tie can actually impact by prevention
So, what's the method to undo
to
this?
undo the process. Now, because it's a structure, we need to we need to address it with the modality of surgery,
I see.
right? So it's a small procedure that can either use scissors, simple scissors, to cauterization or a laser, and different kinds of them. What we do is we do a simple, anesthetic effect underneath the tongue of the baby, and we use the tools like a dental surgeon can do it, or ENT can do it, or a oral surgeon can do it. So what they do is they release
Hmm.
that tightness. So once that's released, then we rehab the entire oral muscles, teach the baby how to do the normal sucking and swallowing, and then the restoration of the function happens.
Usually, at what age is this done?
The
What?
youngest baby that I have attended to is 2 days old.
Oh my God. Okay.
Really, really young. But the faster we catch them, the better, because they are very close to knowing how to feed on their own
Hmm.
until the time passes and they start to compensate and use other muscles that are not supposed to be used. Then they have a altered sucking pattern. So if we attempt to do a procedure later, let's say 3 months, 6 months, 9 months, 1 year, then we have to reteach the muscles. So the re-education of the neuromuscular pathway becomes a bit
Of a
challenging.
child. Okay.
It is a challenging thing, but you can achieve it, but it is a bit challenging. And by that time, I'm not sure how many mothers are still continuing to feed.
Hmm.
You would have lost the opportunity for feeding.
That's very important. They detect it early.
Detect it early. And the interesting part of it is that a colleague of mine who is from Brazil, uh, she's a speech and language pathologist. But what they have done in that country, in Brazil, is that they have they have advocated to the government to bring the screening of the tongue ties at birth.
Hmm.
So that means every baby will be screened to
To
see
have a
whether
tongue
there
tie.
is a tongue tie or not.
So it makes it much easier
Much
to.
easier to diagnose at very early stages, and so the rates of breastfeeding levels can go higher if there is an issue with that.
So now only if the mother has some medical background or some inclination to understand this,
Yes, absolutely.
the child is lucky,
Yes, they are lucky. Otherwise, most
Hmm.
babies fall through the crack. They'll
And then
think,
they
oh,
live with it.
mother's milk is less, so therefore, what they don't understand is that the sucking of the baby is what's going to initiate the milk supply in the mother.
So that plays an important role, and tongue
Very
tie is
important role.
something that is important.
Very simple, like well is there, water is there in the well. If your pump is not working, water is
What
not
can
going to
go? I
come up.
understand.
So the baby is our natural pump. So if the baby is not functioning well, or the sucking is not functional or effective, then you are going to see alterations that will happen. But most people don't understand that. They think, oh, mother itself is not able to make milk. So therefore there is an issue. So let's
So the
not
problem
bother
is with
about
the
it.
well.
Yes, the problem is with the well itself. So they will just stop breastfeeding and they start to give formula for the baby.
Hmm.
And then you have a gamut of issues, health issues that will come later on.
And that adds stress, guilt, and all the other
Everything, not
issues.
just emotional, but physiological stress.
Hmm.
It alters how the cell functions because of the processed food that baby is taking, which is like, you imagine you telling somebody, don't eat the pizza every day. Imagine having to give that kind of processed food for a baby
Hmm.
almost 10 times a day.
I can imagine.
That's a lot to
And
take
you're
and
starting
process.
the
Yeah,
prime time of the baby with that.
with that, yes. And mothers can go through a lot. So I think more than mothers who are having no, we don't have a choice but to have to fall back on it, they need to be supported by the professionals around.
Hmm.
We need to stand up and do what we have to take. Sometimes I tell them, if we all, as doctors, as lactation consultants, as the society, as families, if we need to take 1,000 steps extra to restore one baby and one mother, we should do it.
Hmm. Makes a huge
It's
difference.
really that important.
So if I have to sum up the actionable insights from what we discussed,
Hmm.
first is, if there is an issue with lactation, don't panic. There is
Yes.
help. First
Yes.
thing.
Yeah.
And don't always, to all the mothers, think that it is their problem.
No.
There could be other issues, there could be,
Yeah.
and there is support available.
Yes.
And second thing, understand there is something called as tongue tie and screen it as soon as possible.
Yes.
And then you also mentioned about take counseling if there is an emotional issue.
Yes.
And maybe understand, you could, maybe your best friend could be your support system,
Hmm.
or go for a professional support.
Yes. Yes.
And then where does craniosacral come here? In both the cases, or
In both the cases,
both the
actually,
cases?
it can support in both the cases. Now, wherever there is a process where we cannot engage with your mind,
Mm-hmm.
which is to do with, say, counseling, for example, you can do the work through the craniosacral,
I see.
where your mind is not engaged, but you're working through the body. And the body can start to integrate the experiences you have had in life and the understanding emerges inside of it and say, oh, I feel different about this. I had grief of loss of my parent, which lasted for 15 years, somebody might say. But through a few sessions, then after say about 3 or 4 sessions, the person comes back and says, I feel different about that experience now.
Mhm.
So you can integrate even from the physical body itself.
I
It
understand.
doesn't have to always happen from the mind. So craniosacral can support in positioning, in the tension patterns the baby could have, what the mother is going through, if she's gone through trauma, both psychological or social issues she's gone through, her body also can be reset. So the nervous system can be reset and supported. Your fascial system can be reset and supported.
Supported. Okay.
That's what we can do with craniosacral.
Fantastic. And also, I would like to just reiterate, so that people don't misunderstand. We are not supporting natural birth or, disapproving cesarean.
Absolutely.
Wherever cesarean is required, because it could be a life and death situation,
Yes.
cesarean is
Yes.
great. But wherever possible, go for the natural birth. I think
Yes.
that's what you're.
That's what I'm also saying. Yes. Everything has its place.
Yes.
And we need to honor it. Right?
And only thing is, if we do it on a monetary or a profitable place, that's when things go out of control, and that's where it.
That's where the whole thing.
That's where again, instead of giving natural mother's milk, if you start giving the formula or recipe because of that, that creates another issues because of that.
Right. And so many mothers going through guilt.
Hmm.
They are thinking, okay, nowadays we have pumps,
Yes.
breast pumps. So they sit and pump there are some exclusively breast milk, pumped milk mothers also, which means there's significant amount of time is going in pumping rather than taking care of the baby, because she has to give her milk to the baby. So she sits for hours together to take out the milk and feed her baby. And sometimes there are mothers who have gone on for 1 year, 1.5 year doing this. Right? Now the main thing what the mother needs to recognize is she's not in any competition with the formula milk outside. What she can provide for the baby cannot be given by anybody else. So we have to stop this competition that we tend to have in our mind, to think that, oh, if I have to save every drop of my milk because the formula milk is always available and accessible, then I'm losing the game with it. Instead, there's competition, psychological competition that's created for a mother because she feels less adequate in front of the formula. Instead, can I refocus on restoring breastfeeding and paying focus on knowing that it's not the well that is an issue, but the pump that can be restored.
Understood.
Let's work on that and focus our attention on that. And in between the process of trying to restore breastfeeding, if it requires you to sometimes use some modality like the formula milk, we should welcome it and use it.
Understood.
Instead of thinking that is the enemy. That's not the enemy for us. It can be used as medication till the time I restore it. Because here the fight is between this and that, and who wins what is the whole story. But I think we need to redefine that and bring the focus back to the mother and the uniqueness and the special being that she is, the one who is the only one who can really understand the needs of a newborn innocent soul of a baby, which nobody can else understand. So if we can support that mother to do that, I think you have a long way to have more healthy people in the society.
I think the point is what is supposed to be used only in last resort.
Has
Yeah,
become
has
the
become the
usual
mainstream.
mainstream. Yeah, really, really sad. There's a
I
place
think
for everything.
everything, yes.
Everything has its place, but there is a need to take only when it is required.
Yes.
Yes.
Absolutely.
Yeah.
Thank you so much.
Thank you.